Epidemiological research design. So epidemiology is the study, to investigate the distribution and causes of the disease in the population. And so what are the types of disease in the particular population and what are the causative factors. And the epidemiological studies are generally conducted to investigate the cause of the disease. Either we can use the prospective approach or retrospective approach. So either we can study the cause and we can move further forward the effect, or from the effect we can go past and we can study the cause. So cross-sectional study design. So here we will be determining the sample population and the people those who are exposed and non-exposed, and so the exposed, how many cases are there and non-cases, and the example, the common example you can take the sample population. We are taking the people those are diagnosed of having lung cancer. So in the lung cancer we are taking the patient those who are we are taking a 500 population. In that 500 population, 300 people may be exposed and 200 may be non-exposed. So in exposed, that 300 cases, you may be getting positive cases, that is the cases, and in that exposed you may be getting non-positive cases, that is negative cases. And the second one, non-exposed, the people those are not smoker, even the non-smoker, you may be getting a positive cases and a negative cases. So prospective studies, also known as the cohort studies, and the retrospective studies, also known as the case control studies. So the types of epidemiological study, here two types, that is non-experimental and experimental. Non-experimental, we are having observational studies, and experimental interventional studies. So observational study, we may be doing population-based, a group of people we will be taking and studying, or we may be taking a particular individual, that is a single person. And if you are moving forward the population-based, you may be doing descriptive survey and analytic survey. So the other name of descriptive survey, that is called a health survey, and analytic survey is called ecological survey. And if you are taking only a single person, that is individual based study, we are having descriptive, that is case report and case series, and analytic study. And in analytic, we are having cross-sectional case control study and cohort study. And the same manner, if you are adapting experimental study, that is interventional studies, we are having two options, that is randomized, non-randomized. And if you are going for randomized, that is every person you are giving an equal chance to participate in the study, that is called the randomization. There we will be having control trial or clinical trial. And in case if you are unable to go for randomization, we will adapt, that is non-randomization. There we have quasi-experimental field trial and community trial. And the next, analytical epidemiology, we are having case control studies, that here we are assessing the factor, there may be a present of factor or absent of factor. So here that the individual is exposed to particular and the individual unexpected to particular factor. And in case cohort studies, the individual with the particular studies, individuals without particular studies. And the same manner, if you are opting the prospective cohort study, we will be studying the presence or absence of a particular disease. So cohort study mainly we will go for a longitudinal approach to investigate the occurrence of a disease in a presumed cause. So example, the researcher maybe multiple times she may be observing the smokers for development of a lung cancer. So the same thing, different years, the survey has been taken different years in 2000, 2001, 2002, 2003, 2004, 2005. And so the first, the people those are exposed to smoking and non-exposed to smoking. So if you are analyzing the people those who are exposed to smoking, non-exposed to smoking, they are in control. There is no outcome. They are not diagnosed as having lung cancer. They are free. And the second option, the people those are exposed, that is the people those are having the habit of smoking, and non-smokers. Both of them, they are diagnosed with having lung cancer. So these cases you'll be taking as a case. So case control studies, in this case, causes of disease are investigated, mainly the occurrence of the disease. So mainly we will be seeing a patient with lung cancer. We will always analyze the patient whether they are having the habit of smoking. So here we will determine the study population. In the study population, we will analyze whether the risk factor is present, there is a cause is present, or the cause is absent. Then, whether the cause is present or the cause is absent, we will see the outcome. That is called the cases. And again, the risk factor present or the risk factor absent, both the condition, the outcome or the disease may be absent. So here we will call it as a control condition. Thank you.